Hi, I'm Dr. Ace, and this show is about your health and your life. It's about helping you make the right kind of choices every single day for your health and for your life. It's also to help you reach your potential and become the best version of you. Are you ready? Let's go.
Florida is leading the way in medical innovation using regenerative medicine. Thanks to a new state law, stem cell therapy is now legal, and Adia is here to help you heal. No more long flights or overseas clinics. Now you can get advanced stem cell therapy right here in Florida. From sports injuries to everyday orthopedic treatments, chronic pain and wound repair, our expert team brings science-backed relief without surgery. Adia, the platinum standard in stem cell therapy. Discover the future of medicine today.
My name is Larry Powalisz. I'm from Milwaukee, Wisconsin. When I was 13 years old, moved to Winter Park, Florida. Been down here for almost 50 years now.
All right, Larry, thanks for being on the show.
Thanks for having me on the show.
Yeah, I'm super excited. So let's talk about Adia and Adia Vita. Like, what got you into this whole field of stem cell therapy? It's been around for a little while, but you've kind of come in at a really good time, I think, where we needed somebody to really dig in. So how did that happen?
So 2021, I was diagnosed with multiple sclerosis. Wow. And it was about 8 months after I got remarried. And I was like, I can't have this happen in my life. I was told, so it's about 5.5 years ago, I'd be in a wheelchair within 3 to 5 years.
Wow.
I was called primary progressive MS. That is the worst MS to have. I was going downhill very quickly. My whole side, it kind of looked like I was having a stroke or had a stroke, right, where my whole side was numb, okay? Brain fog, I could not focus. I couldn't write a check because I couldn't use my hand. So I was about ready to lose everything, and the neurologist said, oh, you have to take Ocrevus. That's the only answer, okay? And Ocrevus, when I did the research on it, is a B blocker. It blocks half of your immune system. And respiratory problems, and I was a smoker back then, and it didn't make any sense. Everything they said, there's a chance of cancer, there's all these negative things. Every pharmaceutical has a negative effect, right? There's always some side effects, right? So I started doing research. I found in Russia and in Mexico, they're doing what's called HSCT. That's where they stimulate the stem cells from your bone marrow, bring it to your blood, take the stem cells out of your blood, give you 4 doses of chemotherapy to remove your immune system. So it's not like a cancer treatment. It's not that much, it's not myeloablative. It's not so aggressive, okay? Mm-hmm. They just want to remove your immune system, put your stem cells back in, give you a new immune system. And that's what I had done. And that's been almost 4 years ago now. And I've never had a relapse, no new lesions. I've had a reduction.
You would never, ever know that you ever had any kind of condition like that.
Well, thank you. The only problem I still have is dropping foot in the left leg, because you can't repair every nerve.
No.
But I'm so grateful so many of the nerves did come back. And now that I'm doing stem cells every 4 months, I'm getting even more feel in my leg. So it's coming back even more. So to answer your question is, when I was not in a wheelchair and I came back, and I have a beautiful wife that is, supporting me. We're in the process of trying to have a child.
That's amazing.
I couldn't let the MS get in my way. Okay, so when I came back, I was like, I'm not in a wheelchair. I've got to do something for other people. Most people didn't know about this, or they couldn't afford it.
Right.
Okay, so the first thing I did, I created a nonprofit, MS Heal the World. And we tried getting donations to send people to Mexico. And I sent 2 people, paid part of we didn't get enough donations to pay for their full treatments. I paid for part of their treatments.
Right.
So I said, look, this is not enough. And that was about 1.5 years later. I'm like, it's not enough. I'm not doing enough to help people. So my friend had a public company. He said, look, I'm getting rid of it. I acquired it. It happened to be called Adia Nutrition. I'm like, well, that's interesting. It's Adia Nutrition. It kind of ties to what I'm thinking, right? Sure. So I took that company, which is, it's called an OTC pink sheet at the time. We uplisted it to QB. We'll be, and my hope is to be NASDAQ within the next year and a half. That means we're like a Microsoft. We're like a Tesla. That's my goal. Because once we get that far, then nobody can stop us. Mm-hmm. And that was why I thought going public was the best choice. You have better funding. It's easier to do things. It just makes more sense to me. So,
so he said, you can acquire this company, and then you saw it as what? You saw it as something that could really
the opportunity
make a difference.
to expand on that company. So we went from Adia Nutrition, which is the parent company, we opened Adia Med. Adia Med's the medical company. The only thing I was going to do there was HSCT, because
which is what you had done.
That's correct.
Okay.
So you can do that in the United States. Insurance companies will pay for it,
wow,
but nobody knew it. Okay. So one of the first things I had to do to get it approved is I hired lawyers to contact the FDA and see what they said about using HSCT in the U.S. Well, because of your own stem cells, there's no law against it, okay?
Wow.
Because the chemo products are considered off-label, okay? A doctor has the right to use off-label products. So there's no restrictions to it, okay? At first, insurance wasn't going to pay for it, but now there's been over 10,000 cases worldwide.
So insurance will pay for that?
We'll say private. Medicare, Medicaid still won't.
Okay.
A lot of privates will. You have to fight with them. But anytime you can improve the quality of life, they have to cover it. Quality of life is the most important thing. You can't say no to quality of life.
No, you're right.
If we say that, hey, we can give you a little bit longer life, well, that's not quality of life. If I can take your life and make it be better, that you can possibly walk again, or you don't need as many medications, or you can work again. Because so many people with MS have to quit their jobs. There's no way they can work.
Right.
So within these cases that I studied before I had HSCT done, I found there was an 82% success rate in Mexico, a 94% success rate in Russia. So in our clinic, we're just about ready to start HSCT there. We're going to be using the Russian protocol, slightly modified by our doctors, but it should have a 92 to 94% success rate, which is insane.
It is.
Okay. So anyway, in doing this with the FDA, we got a letter back saying you can do this, but you can't use umbilical cord stem cells. I'm like, why would they say that?
So on that note, talk about that for a minute. So in stem cell therapy, there's a big challenge I think a lot of people have with the FDA and what you can claim and what you can't say and what you can do. Like in Florida right now, they just passed a law in 2025 in July where it made it legal to do stem cell therapy, which is amazing for us because our clinics and our companies are here in Florida.
Correct.
So talk about the challenges when you acquired the company and Adia Nutrition is you're moving it forward, you've got Adia Med. What did you see with the FDA and what was the hurdle that you said, okay, we have to create something to work with them or to show them? What was that about? Like how did that?
So first of all, using your own stem cells is okay with the FDA. They're not going to interfere. The doctor can practice medicine. They can use off-label products as well. So HSCT was not a big deal when it's your own stem cells, okay? But when I was researching after that comment they made, I'm like, there must be something.
And what was the comment?
You cannot use umbilical cord stem cells for HSCT. They must be the person's.
And what is HSCT? Say, just what does that stand for?
I can't give you the exact definition of it because it's been a long day. But basically, it's hemopoietic is using your own cells, okay, to replace your immune system is what it is. And it's originally was designed for leukemia, but that would be to where it was donor cells, not your own cells, okay? And you can use donor cells if it's leukemia. So bottom line is, the doctor, Richard Burt, that he created HSCT for MS, he was leukemia, he was doing a lot of leukemia treatments. He said, I wonder why we couldn't use this for other illnesses, for other autoimmune conditions. And sure enough, he did, I think, 6 different autoimmune conditions. He did ALS, he did Crohn's disease, he did MS, he did all these different things and they all were successful. Wow. And it's interesting that it's taken this long. That was 16 years ago he started this. It's taken this long to say, okay, I guess we can let them try it, right? So then going to umbilical cord, to birth stem cells, I started researching all the different cells out there. And what I found, let's give you Panama, for example, okay? Because you can go to Panama, right? Everybody thought, oh, we're going to go to Panama or go to Mexico, right? Those are grown mesenchymal cells. They put them in a petri dish and they expand them, okay? The problem with that, as I learned, and understand, I'm not a doctor, but I know how to do research, right? Sure. And I know it makes common sense. When you're growing a cell in a petri dish, you now have a parent and you built the siblings. And they keep reproducing by billions, okay? They get weaker and weaker and weaker. I don't even know what stage they're on is how many times they reproduce them, right? So you're not doing with a pure cell. You're doing with siblings, okay? And in doing that, they can mutate and become something else besides a normal cell. So I would never want to do that, but yet that's the biggest thing in the world right now, okay? Looking at mesenchymal cells, or we'll call them tissue cells, Tissue cells would be using the umbilical cord and the placenta, and you grind it, you press it, you take that liquid out, and that's your product. You filter it, that's your product, okay? So mesenchymal do have growth factors. They have certain things. They can help repair cartilage or help repair bone. They can do that. But they're missing other proteins and growth factors that the blood stem cells have. And that's what I found, is I found one company, okay, they're out of Miami, okay? They are minimal manipulated, because that's one of the rules for the FDA. You can't add chemicals. You can't do certain processes that could change the structure of the cell. So all they do is they buy the blood from blood banks, from C-section births only, okay? The blood bank has done all the testing, hepatitis, all these different tests, everything. And from that point, they take them and they just use a centrifuge and they take the stem cells out and the exosomes out. And then they have a way to stimulate the stem cells to create higher exosomes than anybody else. So
with Adia Med and Adia Vita and the product itself, what is the difference between other stem cell companies and Adia Vita, the product itself? So talk about like the number of exosomes versus the amount of stem cells per vial that would go into a treatment.
Right. So one of our competitors, their number one product only has 60 to 70 billion exosomes, no stem cells. Okay, but that's their main product that they're selling.
Which sounds like a lot.
It does sound like a lot until you get to the trillions, right?
All right.
Then it sounds like a lot, right?
Yeah.
So within our Adia Vita, it has 100 million stem cells and 3 trillion with a T exosomes. Okay. Even after thaw, it's guaranteed 70% living, because the new law in Florida required you have to do a COA that includes the vitality after thaw. Okay?
Which is so important.
It is, and I don't know anybody else that gives you that number.
Yeah, that can give you that kind
None
of number.
None of my competitors even have that. Okay,
right.
I don't know how they're getting away with not having that, because you have to know how many are alive, right? That's what's going to work,
for sure.
Right? So anyway, minimal manipulation is huge. Okay. Everything natural, C-section, to me, it makes sense because there's less chance of bacteria as compared to a natural childbirth. Back in like 2018, there was a company that was doing natural childbirths, and they had bacteria in their, and I'm not saying it was just because of the birth, but they had bacteria and they had problems. And I think these are some of the problems of why stem cells were slow. You had a person in the FDA called Peter Marks, okay? Mm-hmm. He literally was trying to shut everybody down with stem cells. I have no idea why he was doing that. But what's interesting is when he resigned last year, what's the first thing he did? He went to work for a pharmaceutical company. Kind of tells you what he was doing, right?
Right.
Slowing down natural, okay? I believe there's a place for pharmaceuticals. Absolutely there is, okay? And I believe some of the pharmaceuticals we could use to help ours, okay? The ones with the least side effects, the ones that aren't addicting, okay? Those kind of pharmaceuticals. So, in my belief, I believe you're better off repairing, okay? And that's what stem cells do, they repair. Your body, when you're a kid, has young cells. Right. You will cut yourself, you're healed so quickly.
Like so fast.
3-4 days, you're completely healed. As you get older, those cells get older. You get less of them, okay? That's what causes wrinkles. That's what causes all the pains, all the inflammation, because our stem cells aren't doing what they used to do. Right. So taking birth stem cells and exosomes gives you that chance again to repair fast, okay? I have a 94-year-old mentor, all right? We gave him stem cells. We're trying to improve his COPD, and it helps, but we noticed, and he first thing he noticed, every time he hit his arm on anything, he would turn black and blue right away, okay? And it would take him a week or two to repair. Now, if he does something like that, it repairs in a day or two.
That's amazing.
His cat clawed him on a Thursday, and I saw this big red
Which for 94-year-old skin would be super thin and just rip right through it and take forever.
Exactly.
Yeah.
So by that following Monday, it's all gone. He has 2 lines from the cat where the cat scratched him. That was it. So within 4 days.
That's amazing.
It is amazing.
So talk about, with the Adia Vita and the product, I want to get into like you were talking about, the mesenchymal versus the blood.
Right.
And why that's such a differentiator. And in this field, as it's growing and emerging, that really has become a gold standard that not everyone does.
That's correct.
So talk about that.
Hemopoietic cells, so blood cells, okay, have more proteins, more growth factors than MSCs. MSCs work, and don't get me wrong, you're going to see...
MSCs stand for?
Mesenchymal stem cells.
Okay.
Tissue cells, okay, and best way to say is tissue.
So we got tissue cells and we have blood cells.
That's correct.
Right?
That's
Adia Vita focuses on blood cells.
Only.
which is more powerful than the tissue cells.
In all of our studies so far, yes, that is correct.
Okay.
And the reason is you're talking one type of cell. You're talking an MSC, mesenchymal cell, right? When you're talking blood, you have mesenchymal cells in them. So out of the 100 million, 1% of them are mesenchymal. Well, that's 1 million cells. That's a lot.
That's a lot.
Okay? But now you're talking other factors. And again, I'm not a doctor, but they gave me a list of all the different proteins, all the different growth factors that mesenchymal cells don't have. Right. So why wouldn't you do something that has a chance to repair a lot of other things in your body? So it's not just, I'll give you an example. We've done a treatment on a patient where they were saying they had rheumatoid arthritis, okay, but they also had a blood pressure problem, irregular blood pressure. We're helping them with the rheumatoid arthritis, but their blood pressure gets corrected. So it's doing more than one thing, okay? The more things in your body wrong, the more treatment you need, right?
That's right.
Because it's going to look for the most inflammation and the worst problem at the beginning, and then repair that first, okay? And then it'll start repairing other things. Right. And remember, these kind of cells stay in your body for 6 months if your body likes them. And here's the strange thing about stem cells, right? If your body accepts them and likes them, they become part of you, okay? Right. And they continue growing. And they'll grow up to 6 months. Mesenchymal cells can't do that. Mesenchymal cells absorb in your body within 3 days. Okay, and nobody's ever said that. Nobody ever talks about that. That's super important.
They can't, because that's what they're primarily using for their product, and so you don't want to talk the downside at all.
True, correct.
Right? So if you've got more living
Right.
in the blood, which we do, it's almost like taking a singular vitamin versus a multivitamin. The multivitamin is going to cover everything in the body.
Right.
The singular vitamin is good, and it'll work for whatever that singular vitamin needs to work for.
Right, but not
But it's
everything
not
else.
covering the whole
Everything
gamut.
else.
And so the
Exactly.
blood stem cells are really covering everything as much as it can cover.
That's correct.
That's possible
That's correct.
within the body.
Right.
So that's interesting. So in the field of regenerative medicine, with where we are now, where do you see stem cell therapy going?
So we're doing all these studies right now, and we're seeing tremendous results, okay? We did one-off studies for autistic children last year. We did 4 children, and every one of them had a significant improvement. 2 of them that I was talking about to a few doctors yesterday. I did a Zoom call with them. The one child, we do what's called an ATIC study. Basically, it determines from 0 to 180 where they're on the spectrum, right? Mm-hmm. The one 11-year-old girl was at 111, which is pretty high. That's like a 3 on the spectrum, right? By the time she was done, she was at 44. So it's like a 67-point adjustment improvement.
That's huge.
So when we're doing a study, we're starting the study, I'll explain to you in a second. According to general studies, a 10-point improvement is success, okay? And we're talking that one had a 60-some point improvement.
That's amazing.
Another little 6-year-old boy, 44-point improvement. That's insane, okay?
But think about that for a minute. Think about the quality of life change.
Correct.
Not just for for the child, it's amazing because it's life-changing.
Right, but for the parent.
But the parent who carries the weight of what they're seeing in their child.
Yes, exactly.
I mean, 12% would be great.
Right.
15% would be great.
Right.
But to see 65, 67%, whatever, that's
huge.
Life-changing.
Exactly.
For everyone.
Exactly. So because of the results last year, we had Dr. Evan Thomas. He's our medical director. He's done other studies in the past. He said, Larry, let's do a study in this. I really want to see what it does to 100 kids, okay? So we applied for an IRB, Institutional Review Board. They validated safety. First we sent them a draft, okay?
And you're going to do this study on autism? Is
On
that right?
autistic children
Okay.
aged 3 to 12, because that's what we did last year. That was the age brackets. We'll probably do a third leg going from 13 and beyond. Because I've already been getting calls from parents saying, well, my kid's 15, my kid's 20. I'd still like to do something.
And there's a cost for the study, right, for parents?
In this case,
yeah.
yes. Let me explain why that is.
Okay.
So if you get a grant, it takes you 3 to 5 years. If you have the government backing it, they all get control of it, okay?
They create the narrative for what goes on.
Yes, so
You wanted to hold on and make sure
Have control.
that it was the best that you could make it
Right.
for the parents, for the child, for everyone involved.
Correct.
Okay.
And I want to have the results be honest. I don't want them saying, well, we're not going to accept this, we're not going to accept that. The Institutional Review Board does that for us. We don't need the government to do it or some grant company to say, they
Not
said,
that they're going to be dishonest, but we want to make
we
sure.
don't want to take the chance.
Yeah,
That's all it
exactly.
means.
I get it.
And time.
Yeah,
To get
right.
any grant, you're talking time, okay? I don't think we should waste any more time. We're seeing 1 in 31 kids now have autism. That's insane.
It's insane.
Okay, it makes no sense at all.
it
Okay,
doesn't.
whether that's environmental, whether that's a vaccine, we don't know what it exactly
Right.
is. But if we can solve it, it won't be as big of a deal anymore, right? So what we did is we did a test using glutathione. Glutathione is an antitoxin. It removes toxins from the body. One of our doctors was using that for autism and getting some good results. Other doctors were using our stem cells, Adia Vita, and they were getting good results. I said, look, let's all have a meeting. The one problem with glutathione, it only stays in your body for an hour or two from the time they do an IV, okay? But it does take the toxin out in an hour or two. So I'm like, okay, what else can we do? So one of the doctors said, well, there's a topical that you can put on your body, put on the child twice a day, and within 3 days, it stays in their body. Now we're constantly fighting toxins and give them stem cells. So that's the study. The study is one side will get glutathione only with the topical, the other side will get glutathione with stem cells. There's a phase 2. Any child that only got glutathione will be guaranteed stem cells for the second phase. Wow. I want all kids to have the same fair. I want to be fair to all of them, okay? I don't want one side doing better and the other side never doing as good. So that's what we're doing 3. And it gives us the answer of all 3. Was it the stem cell, was it the glutathione, or was it both combined? Right. I believe it's going to be both combined. That's what I believe. But we'll see. Yeah. That's what the study is about.
Love it. So talk to me about the study that you're doing with autism. And there is a cost, right, for doing the study. And you're doing that so you can maintain the control of it and that the results are honest. So what does that cost like to a parent?
Right. So typically, if we were doing just any one treatment, it'd be $8,000. If you go to any other clinic that does any type of treatment, it's $8,000 minimum. Yeah. Okay. We're doing each treatment for the child for $4,000. So Adia Med's taking a loss. Okay. We can't take all of that loss, because we are a public company. We do have to address the shareholders. Sure. So we're going to take some loss, and the shareholders have to be okay with that, right? But the idea is that if we get this proven, we get this 100 children, maybe the other 100 children for 13 and older, then we force insurance companies to pay for it from that point on. If we get the result I'm hoping for a 70 to 80% success rate. Now, I talked to a doctor this morning. He thinks we'll have over a 90% success rate because he's been doing studies as well. And if we could get that kind of success rate, what insurance company say no to the quality of life, right? Remember, you're not just giving quality of life to the kid, you're giving it to the parents too. 100%. And you're talking millions of dollars per child because they can never take care of themselves. What we're proposing is if this works the way we hope it's going to work, the child will be able to start taking care of themselves. That's amazing. There's a doctor in Jacksonville. I won't tell you his name because I don't know if he'd allow me to tell his name.
It's all right.
His child is now 24 and can take care of himself, and he treated him with stem cells. Okay, and that's the exact same thing. We had a conversation. Blood. He's using blood stem cells. Okay, I believe that is the magic that nobody does.
And with the blood stem cells, what you found in the different treatments, that IV therapy is now becoming a centerpiece, and that's how you're treating the autism.
That's
the
correct.
doctors are.
Yep.
So talk about that and why the IV is another option, how it floods the system you were telling me.
Correct. So we're going to do another study for lower back pain. And the question is, do we have to inject in the lower back areas, or can we just do IV? I believe the IV is going to be better, because think about what we do is we basically give you 8 cc's of injectable saline to flush your veins. Then we give you a 5-minute push of Adia Vita, and then 10 more cc's of saline. We've just hit your entire body, okay, with stem cells and exosomes. And 100 million stem cells and 3 trillion exosomes going through your whole body. So it's looking for all the places that are damaged. Okay? Remember, the exosomes are the communicators of the stem cells. They tell the stem cells what to do. So the reason we're doing 3 trillion of them, give those stem cells that we just put in your body and your own stem cells a boost and say, hey, we got all these problems, guys. Let's go fix all these problems. Right. So that's what I really believe that study for lower back pain is going to show us a better result with just an IV. And I can tell you for every treatment that we're doing except for orthopedic, it's an IV. If you have rheumatoid arthritis, I'm not going to inject where your pain is. I'm going to give you an IV. I was telling you, I think earlier today, we had a woman, her hand was like this. She could not open her hand. It would hurt too bad, and it was locked, okay? She did the IV. Within an hour of her sitting talking to the nurse and the nurse practitioner and the doctor,
all of a sudden,
her hand's doing this. She goes, oh my God, she started crying.
Oh, it's
because
amazing.
her hand's moving. It's insane.
But you know, in a moment like that, when you see these kind of results, what's that worth? You know, what is that worth to someone?
Right. It's worth
Right?
everything.
When you spend $8,000 for a treatment or $12,000 for a study for a child, what is that worth for the quality of life?
Right, right. Well, the saying is, health is the new wealth, right?
It is.
And it is, right? And my hope is, I hate that that not everybody can afford it. So my hope is that if we can do this over the next couple of years, get insurance to pay for it.
That's what I'm saying. That's why you're doing the studies. That's why you're going public. That's why you're building the company out to not just be a side thing. You want it to be a major player in the stem cell world, in the regenerative medicine world, to say, hey, Adia Med, Adia Vita, we're here to stay, and we're here to make a difference.
Exactly.
I think the biggest part that what I'm hearing of everything that you're saying is that you want to be a company that literally goes in and makes a difference in people's health, in their lives, for families, and to change generations.
That is exactly right. That's my mission for the rest of my life, because I'm not in a wheelchair right now, okay? I have to pay it forward. You know, all the years I was a real estate investor, I have a lot of passive income, I was retired, okay? Yeah. But I wasn't thinking about other people as much. Now that I'm not in a wheelchair, I think of what if I was? And what if this person that couldn't afford the treatment I had done? Because that was an expensive treatment, okay? We've got to look at everybody now and see, I don't want to just help this person, I want to help all of them. You know, that's where I am right now. That's the way I think. And I love the child one. Every time I saw a mother cry because the child spoke, because these were the 6-year-old was non-vocal, okay? 6-year-old was sensitive to touch, okay? The mother, within a week after the treatment, okay, calls me and he said, I'm sorry, okay? Those kids don't understand emotion. The way I describe a lot of children with autism, especially higher up on the spectrum, it's like they can't hear. They're in their own world, okay? And if we can get them out of their world into ours, isn't that like huge?
Huge.
So that's the way I see it. Yeah. And every time I talk to any parent, even when I talk to a person that had rheumatoid arthritis and start moving, you're seeing them crying, getting choked up, or the husband choked up his wife can do something again. It's touching as heck. I mean, that's every moment I get that happening again. You know, another burst of, oh my God, this happened again. It's like a miracle every time you see it.
It is a miracle every time. So what would you say to anyone that's considering stem cell therapy, right? They've read about it, they've seen it. What is a final thought you would give to someone that's really considering it?
Yeah, the first thing I would tell you is don't spend the kind of money you would spend offshore, because they're more expensive than here. It can be done in the United States, in Florida especially. In Florida you can do orthopedic, pain management, wound repair, which is almost everything. Yeah. I mean, if you have pain, we can treat you, right? You could tell me you have pain for arthritis, you have pain for whatever it is, right? We can treat you for it. The biggest thing I would also say is do your research. Ask the questions. So if you're going to go somewhere, how many stem cells? How many are guaranteed living? Okay. Do you use exosomes? Because exosomes are important. Okay. What things are you getting? And just don't make sure you're not just getting fluff. When they're saying LED lights, okay, and you're going to be there for a day, that's not long enough for LED lights. You need a lot longer time for that. Hyperbaric chamber does have some positive effects. But not as much as ozone does, for example. They throw all this big package, oh, you can get this massage, you can get this, you can get that. Most of it's fluff.
Bottom line is, know the product, know what it does, know what's in it.
Correct.
Right, and don't go out of the country.
In my opinion.
Come right here to Florida.
That's correct.
Larry, thanks for being on the show.
You're welcome. Thank you.
Always great having you.
Yep, thanks for
That's
inviting
why
me.
we're partnering with you and our clinic and taking this message around the world.
That's great, great. And your clinic's going to do amazing.
Yeah, thank you.
Yeah.
Awesome.